Time now for the Spine Doc, putting you on the road to better spine health, featuring Dr. Pasquale Montesano, MD, world-renowned orthopedic surgeon and spine and joint treatment specialist at Montesano Spine and Sport, with offices in Palm Beach Gardens, Miami, and Naples. Dr. Montesano is a pioneer in the development and application of the revolutionary A2M treatment for lasting proven relief of chronic pain and discomfort in joints. Now, here's your host, Brian Content.
Hello once again, and welcome to The Road to Better Spine Health with the Spine Doc, Dr. Pasquale X. Montesano, MD of Montesano Spine and Sport, with offices in Palm Beach Gardens, Miami, Naples, and San Juan Capistrano, California. Glad to be with you again, Dr. Montesano. You're looking rested, but I know you were out of town and came back with a little, illness?
Little hoarse voice. I was skiing out in California and in Lake Tahoe area, and I was the one who knew the trails, so I was screaming to my 13-year-old a little bit to make sure she didn't get lost, and lost my voice a little, but I think I've gotten most of it back.
Well,
you
were out there. Hoarse. You were out there, I guess, in between some snowstorms too. A pretty treacherous.
It was incredible. We had 4 feet of snowfall in one night.
Of course, now we are here, as we are each week, to talk to Dr. Montesano, who is a renowned expert at spinal surgery, but also he's an orthopedic surgeon, and he treats all kinds of illnesses or maladies associated with spinal injuries or joint pain or broken bones or whatever. But a lot of your practice has to do with not only doing surgery, which I know you've just come from a surgery this morning, but in your general practice, you treat a lot of athletes, a lot of people who have nagging back injuries or nagging joint and bone pain. So that's what we're really focusing on, and some of the treatment methods that are available out there for helping patients get through some of these long-lasting nagging pains and such. So what I wanted to talk about is one of the innovative techniques that you've been using, that you've been championing because of the effectiveness of it, and that is the A2M injection protocol. So let's talk a little bit about that and how that has proving to be one of the most effective treatment measures that you can take.
Well, Brian, that's right. I mean, my role is to try to get people back in the game, whatever their game is, back to work, back to functioning, back to their families, and improve their quality of life. A2M has really come a long way in doing that. Alpha-2 macroglobulin. It's produced by your own liver. We have to harvest it from your blood. The procurement process sounds a little bit like some of the other treatments that are out there, such as PRP, but there's no scientific evidence to date that PRP is effective. There's over 30 papers that discuss PRP. All of them conclude no positive effect can be found. The American Academy of Orthopedic Surgeons website echoes the same opinion about PRP, platelet-rich plasma. The problem is, Brian, that PRP has over 400 proteins in it. Some of those proteins are good and some of them are bad. So the bad proteins counteract the effects of the good proteins. Brown University calls A2M, alpha-2 macroglobulin, the master cleanup protein for arthritic or disc problems, for inflammation. And so it is the one protein in your blood that you want to procure, concentrate. We get it concentrated about 6 to 8 fold over what it is just in your blood. And then we inject that more or less pure A2M alpha-2 macroglobulin into the affected area, whether it's the knee, the hip, or it's the spine. And if it's in the spine, we can inject it into the disc. We can do direct interdiscal injections with it, or we can inject it into the back of the spine into joints called the facet joints.
Now, some of the other methods, like you had mentioned, platelet-rich plasma, and there have been other treatments for, let's say, knee pain, and where you can inject into the joints chicken cartilage, hyaluronic acid, things of this nature. How does A2M compare with some of the more traditional things that we've heard about for treating joint pain and trying to get that repaired?
While there are many treatments that are commonly used, I'm not aware of any scientific data that proves the effectiveness of any treatments other than alpha-2 macroglobulin. And what alpha-2 macroglobulin does is it stops the inflammatory process. You know, why, if you have a tear in the cartilage in your knee, can you have good days and bad days, good hours and bad hours? The tear's not changing. What's changing is the level of inflammation. Why can you have a herniated disc and have good days and bad days? The herniated disc doesn't change. The inflammation changes. Why can two guys have the same looking herniated disc and one's in no pain and the other's in pain constantly? Once again, it's because the symptomatic person is inflamed. So the A2M, the alpha-2 macroglobulin, knocks out the inflammatory process. When a joint becomes inflamed, it produces what's called a biomarker. And so what A2M does is it prevents the formation of the biomarker so that it treats the symptomatic individual. And it appears that it can stay around in the joint, in the disc, in the cartilage for up to a year. So it's an ongoing process where it's fighting the inflammatory process.
So it's basically a one-shot, literally, deal?
I've injected the discs of over 100 patients now. I haven't had to re-inject anybody where it's been effective. Now, that's not to say that I won't have to inject some of those people in the future, and I've been doing this for about 3 or 4 years now. But it does stick around. If there have been a couple of individuals treated that went on to participate in some type of sport, some type of competition, and those people have had to have another injection when they competed again. But the normal person isn't going to have an injection and then pound the hell out of their joint right after that.
Right. Not a good idea.
Not a good idea.
Now, what as far as how long does it take for the shot to set in, let's say? Is it instantaneous, days, weeks?
It usually takes about 24 to 48 hours before it starts working. The peak effect probably is at about 2 to 3 weeks, and then that effect usually stays. There have been situations where it's taken a little bit longer, and there's been situations where it's taken a little shorter, but on average, about that length of time.
Now, the other things we've mentioned, the PRP, the chicken cartilage, the hyaluronic acid, are these results of these things based on just anecdotal? Because you said there's no real studies that show that some of these things do not really work.
You know, our job is as a physician is to try to help in whatever way possible. And, you know, there's an ongoing effort to try to administer that help in as least invasive of a way as possible. So these attempts are all attempts at trying to achieve that goal. But of the attempts that have been made, it's only alpha-2 macroglobulin that's had any scientific proof that it works.
Okay. Now, so what is your feedback? I mean, I can only assume you had used these other treatments in the past. Have you? The hyaluronic acid, for instance, when that first came out as like the next big thing, so to speak? Or is that something you stayed away from because it didn't have the science to go with it?
I used it a little bit, but I always knew that it was lacking in science. And the results of the A2M have been outstanding to date, so there's no reason for me to try to use anything else. It's an intradiscal injection or an injection into the joint. These injections are done under fluoroscopic or radiographic control, so you can put the protein exactly where you want to put it.
Mm-hmm. And what about cost and whether insurance can cover this sort of thing? I mean, is it a very expensive one-shot deal? And if you get that kind of relief, I would think it would come with a price tag.
Well, all new treatments are excluded from insurance reimbursement for years, really, until the insurance companies are basically forced to reimburse for them. So at the present time, none of these treatments with any of these biologics are reimbursed. But we are finding a lot of acceptance of the A2M injection, and we've been getting some reimbursement. I think as time goes on, it'll be more and more. We tend to combine these injections with the other injections that are approved. So, for instance, this allows their surgery center stay and some of the other ancillary costs to be covered, but the protein itself is not covered.
Okay. So for a patient, that means would there be a significant cost up front for something like that? Or with you administering this, is it something you can work with the patient? And I'm just trying to get an idea of what type of hit something like this would be if, let's say, you're just a Joe average guy who's got, a bad, lingering pain problem in his knee.
Well, to have one of these injections, the total cost would end up being thousands of dollars. Most of that would be covered. So what ends up not being covered, if it's a knee, for instance, then the cost to the patient is going to be anywhere between $3,000 and $5,000 for one knee. If it's the spine, the cost is going to start at around $5,000, and you can go up from there, 10, 15, once again, depending on how many levels, whether it's done front and back or just in the back, or exactly what is done. But you can work that out ahead of time so the patient understands ahead of time what to expect. And then they make a decision as to whether they want to proceed or not proceed.
Now, I have to assume that the cost is substantial because of the R&D that went into developing this, the process of removing your own blood and having to go take that to a lab, have it spun out. I mean, there's just a lot of things that have to occur before you can give the injection.
Correct. It has to be spun, so there's a kit for spinning it, so there's a price to that kit. And then it has to be filtered. And unlike any of the other biologics that don't have to be filtered, the filter kit is quite expensive. So just the kits are going to cost about $1,200. And that's not that kit can be used no matter how many joints are injected. So you have the same cost if you're going to inject. The same kit costs, the same expense if you're going to inject one knee or two knees, if you're going to inject one disc or three discs.
So that could be combined at the initial time with the kit.
Correct. For instance, I did that.
Can you store this
No.
for some future time?
No, and normally you're going to want to use all you get. Let's say in a typical patient, you're going to pull off about 70 cc's of blood. And through that 70 cc's of blood that you draw off of their body, off of one of their veins in their arm, you're going to end up with anywhere between 6 and 12 cc's of A2M. If you did a disc, the disc was going to take anywhere between 2 and 3 cc's. And if you did a segment, you could do the disc and the joints in the back. Those are called the facet joints. And there's a medial branch area, so those areas could take about 2 to 4 cc's apiece. So if you did one segment, that would require probably about 9 on average, but it could be less, it could be more. And sometimes you have to accept what you get. In some patients, you're not going to be able to get that much, and you might have to bring them back. Mm-hmm. And the patients need to understand that ahead of time.
And they were told that, obviously, that's all explained up front.
Correct.
Now, we have one of your patients who is going to be joining us momentarily to talk a little bit about the A2M process, the experience that he has had with this, and tell us a little bit about the effects that he's feeling from having had the process done.
Actually, Brian, it's a mother and son team, so each of them has been treated, and we'll be able to find out how each of them did. Okay,
so let me rephrase that, okay? We're going to cut here. So we're going to be speaking now to a patient of yours, two patients of yours that have had the A2M treatment done most recently.
That's correct. It's going to be a mother and a son. The mother had the A2M. The son had a conventional injection. A lot of times we'll do them first in a conventional setting because it's cheaper, and if that works, then we don't have to progress on. But so we'll get to see the difference between a conventional, what we call medial branch block, and a medial branch block using the alpha-2 macroglobulin.
Okay, well, let's bring him on right now. Dr. Montesano, this is Giuseppe, right?
Giuseppe, are you there with your mom, Paula?
Yeah. Well, my mom just had to step into her friend's house just to get a little thing, but she should be in a few minutes. But I am here.
Great. Now, Giuseppe, you and your mom are from Syracuse?
Yes.
And we're not talking about Syracuse, New York. We're talking about Siracusa, Sicily.
Sicily, yes.
And when I met you and your mom, I think you remember, I thought it was brother and sister. Your mom looks so young.
Yes.
And how old is Mom?
My mother is just turned 58.
And she's a blonde hair, blue-eyed Sicilian. A lot of people don't realize that almost a third of Sicilians are blonde hair, blue-eyed because of the Germanic occupation there. The last two kings were both named Roger, for instance. But anyway, Giuseppe and his mom are originally from there. They became my patients. And both of them had herniated discs in their neck and in their back. And, I think as always is the case, you try therapy first. You try what we call tincture of time, fitness, and both Giuseppe and his mom are very fit. And so when all of those things didn't work, the next step, rather than to think about surgery, is to think about some injections. And you can do conventional injections, what are called medial branch blocks, and you can use Marcaine, which is a long-acting anesthetic, and you can use cortisone as well. But the other alternative is to use A2M, alpha-2 macroglobulin. And so we kind of split the family here, and with Giuseppe's mom, we did the A2M because we thought it was a little bit more severe. She had 4 herniated discs in her neck and 2 herniated discs in her lumbar spine and a condition called spondylolisthesis where one vertebra is slipped on the other. She has about a 50% slip, which is a significant and big slip. And we treated her with A2M. Giuseppe had pain in his neck and his back and then in between his shoulder blades too. He's got multi-level herniated discs, but each of them is a little bit smaller than his mom's. And so we went with the conventional medial branch block using Marcaine and a steroid preparation. Giuseppe, tell us how you're doing right now.
After you did my cervical and my lower back, they felt incredible. On the third procedure that you did for the thoracic area, I was in such excruciating pain. After the procedure, I was a little sore, but today is the third day or second day, and I feel like $1 million, doc. Yeah, after you did the procedures on the back area, and after you did her knee, she is walking like she is back in her 20s. She is very productive, very in a good mood. She's feeling great. She just feels young again and feels absolutely just great. She's always bragging about you to me and to family, how such a great doctor you were, and you just really did miracles for us and for her. She's, like I said, she feels like she's back in her 20s, meaning in the sense of where her mobility is just great.
Well, that's really good news to hear. And Mom had very severe cartilage damage in her knee, in both what we call the medial and lateral compartments. And I'm just so happy and delighted at the result that we got there. Because if that doesn't work, then really the only alternative is going to be to think about a total knee.
Yeah, but like she was saying, as of right now, she's walking. She can literally, pick things up on the floor as it before, where she would have to use chair assistance and just move slowly. But now, like I said, she's moving as if she was back in her mid-20s, and she's feeling great.
Giuseppe, can I ask you a question?
Sure, no problem.
This degenerative condition, was this something that you had tried other treatments for before Dr. Montesano?
The only treatment that we've ever tried was chiropractic, but as we were told, our damages, chiropractic really doesn't solve that problem. But no, she's never gotten any kind of treatments like this, and this is probably one of the best decisions that her and I have ever gotten. And this is whatever what Dr. Montesano did for us. It was, like I said, it was just magical and just a life-saving situation where the pain that was limiting us from everything is now made us feel like we can be productive people again.
That's awesome. What kind of occupation do you and your mom have? I mean, was degenerative from years of playing sports or hard work or what?
Yeah, my first main injury was playing hockey. My mom was a hairstylist for 20 plus years, and then she became a massage therapist. I just really didn't have any other injuries that was only done to my knee. Everything else was just working.
Yeah, Giuseppe never had any spine issues before. He just had a knee problem, and his mother also just had a knee problem before. But recently, what caused their situation that led to the treatment that they're undergoing was they were in a pretty bad car accident, and that brought on the symptomatology. And hopefully we've been able to, using a very minimally invasive technique, take their pain away.
That's awesome.
And, yes, and you absolutely did take the pain away, doctor. Like, when I do see you on the next appointment, I would generally would love to give you a hug for such a phenomenal job.
Well, I like hugs, so.
Couldn't get a better testimonial than that, Dr. Montesano.
Brian, their injuries were rather significant. I have found in my practice that chiropractic, as well as other conservative methods of treatment, can be very effective. And they always should be tried first. It's when they're not effective, they're not going to help everybody, just like I'm not going to be able to help everybody. But when they're not effective, that's when we move on to a more aggressive approach. And in some situations, after I do the injections, I'll return them to chiropractic or physical therapy for a couple of weeks just to get the joints pumping and loosened up.
Right, and that's a key component to the recovery process, to keep the blood flowing, just keep the joint lubricated,
Correct.
Working, and so forth.
Correct.
Absolutely.
And that pumping also distributes the alpha-2 macroglobulin throughout the joint.
Mm-hmm. Well, Giuseppe, it's been a pleasure speaking with you. I'm going to hold on here just a moment, okay?
All right, thank you.
Thank you for saying that. I really appreciate that.
All right. Well, again, that's quite a testimonial. It's a shame we couldn't speak to his mom, but I'm sure she would have nothing but good things to say, because the feedback you've gotten already, I think, would bear that out, right?
Well, Brian, I don't mind that we can't speak to her because she was working, and that was really the goal, is to
Sure.
get her back to work. But we can try to talk to her on another occasion. And we're going to be speaking about A2M coming up at Carmine's Restaurant, La Trattoria. It's going to be this coming Tuesday. Quote that correctly. It's the 24th of January,
right, at
6:30. And some of my patients have said that they would be there. We'll see who shows up. And if anybody's interested, they'll have actual patients they can interview and ask questions to, along with hearing a little talk by myself.
Great. Now, of course, Carmine's is a landmark, that whole area, that northeast corner of PGA Boulevard and Prosperity Farms Road. 2401 in the Harbor Shops is the location of La Trattoria, and literally a stone's throw from your office in the Gardens. That's correct. My office is just down the street on Prosperity at 11,000 Prosperity. And Carmine's and his whole family, they're just fabulous people. So I'm glad that we're having the event over there.
Sheila, his wife, has helped us, and Johnny, the manager there, has helped us to put this together.
Well, that'll be a nice casual way for you to speak a little bit more about your treatment processes, the A2M methods, and get people to have a chance to ask questions from the audience you're watching, and there'll be some refreshments and such going on there. A nice get together.
Brian, I look forward to these talks so much because I learn as much as I teach. You have to keep an open mind. You have to listen to your patients, and I love to get questions that I don't know the answer to so that I can research it, and then I increase my fund of knowledge as well.
Well, we hope you all join us for that. Now, before we go, I did want to talk a little bit about Cytonics Corporation, which I believe is a local company that is actually helping to develop not only A2M, but other cartilage and joint treatment methods.
You're absolutely right, Brian. Dr. Gaetano Scuderi heads that up, and he's a brilliant guy, just an awesome individual, awesome orthopedic surgeon. And he was the guy that started that lab. It started at Stanford University in Palo Alto, California. And then it was moved to Jupiter because Jupiter is one of the few communities that offers biotech research grants. And it was through Cytonics that the A2M process was developed. Mm-hmm. And I've been part of the situation. It's been since day one, and it's been a very enjoyable journey. And it's just wonderful to be part of history like this.
You've been listening to Dr. Montesano of Montesano Spine and Sport in Palm Beach Gardens, with offices also in Miami, in Naples, Florida, soon to be in Las Vegas, also San Juan Capistrano in California. Longtime veteran, expert, renowned, accomplished, many accolades, published many books, countless articles. You are at the top of your field, sir, and it's been a pleasure speaking with you and knowing more about the processes involved in the road to good spine health.
Thank you, Brian.
I want to direct people to your website is SpineDocs.org, SpineDocs.org, or give the office a call, 866-79-DR-SPINE. That's 866-79-DR-SPINE. Check out Dr. Montesano. If you have nagging pain, if you have degenerative discs, if you're just not getting the right answers from your current doctor, you want to try something new, come to a man who knows from the top down and the bottom up how to deal with these injuries to the spine and problems with joints and just overall degenerative problems with people. And again, this Tuesday night at La Trattoria at the Carmine's Complex in the northeast corner of Prosperity Farms Road and PGA Boulevard, and that'll start at 7 o'clock?
Correct. And, if anybody has x-rays, MRIs, feel free to bring them. And if we've got the time, we can kind of go aside privately and I can take a look.
You've been listening to The Spine Doc with world-renowned orthopedic surgeon Dr. Pasquale Montesano, MD. For more information, visit us on the web at spinedocs.org. That's SpineDocs.org. Or to make an appointment, call 866-79-DR-SPINE. Join us again next week for The Spine Doc, putting you on the road to better spine health. Better spine health. Better spine health. Better spine